Well, this is Greg Downing with Texas Medicare Advisors here in beautiful Austin, Texas. And this very short video is designed to help you understand what your Medicare Part A covers and does not cover, and the same thing with Medicare Part B, and why you need a Medicare supplement plan and how these work together to give you great coverage. All right, so let's get started and take a look at exactly what it is that you're getting. All right, well, with Medicare Part A, which is your hospitalization, that doesn't cost you anything, and the reason is you worked your whole life for that. That's basically your hospitalization coverage. Now you can see it does have a deductible of $1,300 every year. And the thing that I have a concern with is if you're in there for any type of extended stay in the hospital, say more than 60 days, you have to come up with a $329 copay. After 90 days, it's $658. And God forbid if you're ever in there for more than 150 days, you're responsible for all costs. There is no coverage. So that's why you want a Medicare supplement to cover these expenses, your deductibles, these possible out-of-pocket costs. Also, what a lot of people don't know is you're responsible for your first 3 pints of blood, which is kind of crazy. I don't know why they do it, but it is. And a pint of blood can run you about $500. So if you take 3 of those, that's another $1,500 out of pocket you could be responsible for. Now, works similar if you go into a skilled nursing facility. You've got that deductible if it applies, and as long as you're in there for a short period of a time, there is no cost. But if you go past 21 days, there is coinsurance pays per day. And again, if you go longer than 100 days, you've got all the costs. So you want that to be covered so you're not eating up your retirement money on medical expenses. Okay, now let's talk about Medicare Part B. Most people are going to pay $134 for Medicare Part B unless you are a high income earner and they charge you more, and that's just the way our government works. But for most people, they pay $134 a month, and that's for your physician services and preventive care. It does have a deductible, but it's only $183 every year. And once that's met, you basically pay 20%, and Medicare pays 80%. All right, and that sounds good unless you get a $10,000 doctor bill. That means you got to come up with $2,000. And if you get $100,000, well, you can do the math on that. So on your Medicare Part B, preventive services, if they're not free, you pay 20%. Same with mental health services, ambulance, and if you've got to buy any medical equipment, you're responsible for 20% of that. So what we get a Medicare supplement for is to take care of that 20%, so there are no exposures there when you get sick. We want that all to be covered. All right. Now, what I've done is I'm just going to show you, and this is what you have attached to the email, and it shows you how these different supplements work and what their costs are. This is just prepared for a female that's 65. But let's look right here. We're going to look. This is a chart that comes right off out of the Medicare Guide and You Handbook. But it shows the different types of Medicare supplement or Medicare gap plans that are available. Now, you'll look right across here, A, B, C, D. These are all Medicare supplement plans, right? A lot of them we don't sell. They don't pertain to you. You've probably heard the most popular plan is F because it's the best plan, but it's not the most cost-effective. And then there's Plan G, which is what I recommend, and most people sign up for, and some of these other plans aren't even sold anymore. Now, if you recall, let's look over here at the benefits. On your Medicare, remember, if you're in there an extended period of time, this gives you an extra 365 days of coverage, so you don't have to worry about those copays. Takes care of all that. Your Medicare Part B coinsurance copays pays for that. First 3 pints of blood. Pays for any hospice costs, skilled nursing facility costs. Medicare Part A and B deductible, plus sometimes doctors charge extra. Covers that on your excessive charges, and even gives you foreign travel. If you're out of the country, you have coverage. So yes, it's the best plan, but the plan I recommend is Plan G. Why is that? Well, it's the exact same plan, except for you're responsible for the deductible on Part B, which is $183. And if you do the math, $183 divided by 12 months is only about $15. So your cost shouldn't be more than $16 a month more, but what you'll find out when I show you some of these cost comparison, it may be $50 more a month just to get that benefit. Plus, Plan F will no longer be able to be sold in 2020, so this is the last year we can sell it. So it's not what I recommend. So Plan F and Plan G, what I've done is I've showed you some plans. This is, again, for a female that's 65, that's married. There's some discounts in here, non-tobacco user here in the Austin area. These just happen to be 4 plans that I work with. Puritan, you can see the cost there at $112 for a Plan F, Mutual of Omaha, Blue Cross, and then AARP, United Healthcare is, these are both expensive plans. No difference in any of these other than the cost of them. They all provide the exact same coverage. Hop over to Plan G, and what you'll see is, wow, here's Puritan and Mutual down here around the $90 category, where a Plan F over there is $150. That's $50+ more a month. So I'd recommend, getting one of these lower cost plans. Blue Cross, it's too expensive. United Healthcare is too expensive, but obviously they do a lot of advertising, and I thought I canceled my thing out. I apologize for that. Let's get out of here. All right, let's get back over here. All right, so these are the plans. So what I did was, let's just say you like Mutual of Omaha because Marlon Perkins and Jim and all the great guys on that show, like I did growing up as a kid. They're great to work with. Let's get a Plan G. So how much is it going to cost for you to move to Medicare, where your Part A is covered at 100%, your Part B $134, your Medicare supplement? We get a drug plan. This is just an average cost plan, $23.50. So this individual female is looking that her hard cost on a monthly basis with Medicare is going to be about $250, okay? So that's the same thing you'll see on yours. I just want to explain how that works. Your numbers are different because you live in a different area, you're male, you're single, whatever. All right? So what do you do now? Well, what you want to do now is you want to pick up the phone and give me a call, 512-656-9378, and pick one of these plans and say, let's get signed up for it. We'll get this in place. You can get these plans up to 6 months prior to your effective date. The reason you might want to do that is just to lock in the rate so you don't have to worry about it going up a couple, $3. That'll save you some money. All right, so again, give me a call, 512-656-9378, and you have a blessed day, and let's get covered on a Medicare supplement plan.